Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Norfloxacin. Its brand name is Noroxin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Norfloxacin acts by inhibiting bacterial DNA synthesis. It's a broad-spectrum anti-infective agent, and it has a wide spectrum of action against both gram-positive and gram-negative organisms. In terms of indications for use, norfloxacin is indicated to be used in the treatment of gonorrhea. It can also be used in the treatment of bacterial conjunctivitis. This medication can be used to treat prostatitis as well as urinary tract infections. Now, before somebody was to use norfloxacin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to norfloxacin or other quinolones or any other component of the product, they would not be able to use this medication. And it would also be contraindicated in patients who have a history of a tendon rupture while using norfloxacin or other quinolones in the past. Now, in terms of precautions, patients should be made aware about the potential CNS adverse effects such as hallucinations, anxiety, insomnia, depression, severe headaches, as well as confusion. Caution should be used if this medication is to be administered with Class 1A or Class 3 antiarrhythmic agents. Convulsions, increased intracranial pressure, and toxic psychosis has been reported with the use of norfloxacin. Patients would be at more of a risk of experiencing these if they have known or suspected CNS disorders, such as epilepsy or severe cerebral atherosclerosis. Elderly patients who use norfloxacin may be at an increased risk of toxicity due to a usual decrease in renal function. There's a risk of a phototoxic reaction in patients who have excessive sunlight exposure while using norfloxacin. Hypersensitivity, including severe and sometimes fatal reactions, have occurred, so the medication should be stopped at the first sign of rash, jaundice, or other signs of hypersensitivity. Patients with a history of peripheral neuropathy should generally avoid the use of this medication. And finally, it should be noted that strenuous physical activity may increase the risk of experiencing a tendon rupture. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use norfloxacin, they can expect to receive their dose orally. If somebody is using this medication to treat an uncomplicated urinary tract infection, they may use 400 milligrams every 12 hours. Depending on the organism that is causing the infection, they may use this regimen for 3 days or up to 7 to 10 days. For a complicated urinary tract infection, they may use 400 milligrams every 12 hours for 10 to 21 days. If a patient is using norfloxacin to treat prostatitis, they would typically use 400 milligrams every 12 hours for 28 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using norfloxacin, so we'll go over some of those here now. 3 to 4% of patients may experience nausea while using this medication. About 2.5% may experience stomach cramps. Dizziness may happen between 1.5% and 2.5% of the time. And about 2 to 3% of patients may experience a headache. Now, some more rare but serious side effects would be some dermatological reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis. Patients may rarely experience Clostridium difficile-associated diarrhea. Hepatitis, jaundice, and liver failure are possibilities. And finally, we also mentioned the rupture of a tendon. That's all we're going to talk about today with norfloxacin or Noroxin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.